Do you ever get curious about the side effects or long-term issues with using perhaps just over-the-counter drugs or prescription drugs? I know I do, and a big reason why I got into this field of food and fitness is because I had a huge amount of struggle with prescription drugs over a long period of time. So today I am super excited to dive into some of these questions about over-the-counter and prescription meds with my friend, Dr. Ben Cho. Ben, hello, how are you?
Hello, I'm fine. How are you?
Good to see you. All right, so yes, we're in a little close quarters here. But I wanted to know, one of my biggest questions is, and something I hear from clients a lot is, what should we be worried about with regards to taking prescription drugs either in the short term or long term? And are there any over-the-counter things that we should be especially cautious of? It just feels like a big mess and mire of confusion around the pharmaceutical industry.
Yeah. Well, I should preface this by saying I'm a pathologist. I don't prescribe medications, and part of the reason I chose pathology was we don't prescribe medications. I'm sort of on the spectrum of physicians' attitudes towards using medications or not using medications. I definitely fall on the side of being more of a medication skeptic.
And I'll say that aligns with what I hear from a lot of my clients and students too, who feel like what happened to me as well is that you wind up on a very slippery slope, and suddenly, in my case, I was taking, 10 different psych drugs at once. So that's one of the confusing points. Many of my clients and myself would feel like we couldn't tell if the side effects were warranted or if this was just the norm and how to make sense of it, what to do about it.
Yeah. Well, medicine is really, really personal for everyone. So even if general side effects, if you're having a side effect that's not listed on the medication package, that doesn't mean that it's not due to the medication. It might not be common enough for them to list it as a common side effect. And just because a healthcare provider recommends that you take something doesn't mean that you should feel obligated at all to take it if that's not in line with what you think is right for yourself. My attitude toward medicine, as I've told you before, is reflect on how much you need the medication in order to function. Because as we've seen in various cases that have come out not in the past and continue to come out, FDA approval is a long process, but it's not infallible. And sometimes the long-term side effects of medications don't manifest until they're in widespread public use, and in widespread public use for a span of time. And then people start manifesting the long-term effects of it, and then it sort of becomes well known, and then there have to be FDA recalls sometimes, or even pulling of the approval of medications.
So it's kind of like there's a tremendous question mark and a long tail that you might be dealing with.
Yeah, so there's a risk. I mean, the FDA is great. We couldn't function without an FDA, but it's not the end-all be-all. It's not, it can't, they're not going to necessarily do, 50, 70-year trials of a drug before releasing them. It wouldn't be good for patients who really do need them.
And it wouldn't be economically feasible either.
Exactly.
Yeah.
But knowing the limitations of what an agency like the FDA can do, I think it's good to be aware that since there could be side effects that are yet unknown, having a high threshold for taking medications, in my opinion, is prudent. So the question I always ask myself is, if it were to come out 20 years from now that a medication had a side effect, would I look back on it and think, why did I take that? Or would I think, wow, I was in a place where I couldn't function without that medication. So side effects be damned, I needed it. So, that way you can at least have some peace of mind that, I didn't do this frivolously, or I didn't go into this not knowing. There was a risk for a side effect, and bad luck being what it is, it sometimes hits us. Okay, I was a victim of bad luck, but not of a careless decision, So.
That's smart. May I ask you about some common things that we see? You had some interesting commentary around Tylenol earlier.
Yeah.
So I just want to go over, these are a few things most people have in their home, and may use them with varying frequency or not. But let's go over Advil, Tylenol, and sinus and allergy meds. This is all I could dig up. I don't have that many things around. So
generics that have been in use for a long time, I'm way more comfortable taking than sort of new things, because you've got the experience of hundreds of years of people taking this, and you kind of know the side effects. So I was talking about Tylenol is actually can be quite toxic to your liver in high doses. So when they say, don't take more than a certain amount over a 24-hour time period, that is absolutely true. You should not. And people can overdose and die on Tylenol. People who are feeling self-destructive do overdose on Tylenol, and it can be very devastating on the liver. There are some who have even argued that Tylenol in this day and age might not have been approved by the FDA for use because of its hepatotoxicity or toxicity to the liver.
And is just simply drinking more water and kind of watching your nutrition, if you're taking Tylenol, is it going to make a difference?
If you take Tylenol within moderation, which most people do, then I don't think so. And you certainly can't dilute the effects of an overdose of Tylenol by drinking more water.
No.
That's
not going to solve it. No.
But I mean, having said that, so Tylenol is cleared by the liver. The other major organ that clears drugs, or different classes of drugs, is the kidneys. And certainly for kidney health in general, water is essential. So, what the kidneys do is the blood throughout your body goes to the kidneys to be filtered, to take out toxins, waste, which then goes into your urine, and then the sort of cleared out blood continues out of the kidneys to the rest of the body, right? So the kidneys, it's important for the kidneys to have a good flow into it, but not too much flow, and that's why, staying hydrated keeps the flow going, but having hypertension or high blood pressure means that too much blood is getting into the kidneys at once. It's overload, sort of like trying to drink from a fire hydrant, right? And then any toxins in your system, including drugs, any foreign materials, could potentially be damaging to the kidney if it's filtering them out. So
Tylenol bears caution.
But Tylenol is not Tylenol is cleared by the liver, not by the kidney. So,
right.
But in general, as a general rule, drugs are either cleared by the liver or the kidney, and so kidney health is important for clearing drugs, and so essential to kidney health is hydration. So.
Okay. Anything worrisome about Advil or concerning?
So the main concern that possibly many people may feel the side effects is concern to the GI tract lining. Oftentimes I think people will take this class of drugs, which is ibuprofen is a generic of Advil, which is a non-steroidal anti-inflammatory drug, or an NSAID.
Right on the label. Yes.
And taking those can sometimes irritate the stomach lining. And we see, as a pathologist, I see biopsies of stomachs, and there's a characteristic pattern of what's called chemical gastropathy, which is oftentimes pill-induced by NSAIDs. You can see it throughout the GI tract, actually. You can even see it in the lower intestine, in the colon, and of what could be attributed to injury due to NSAIDs. And it's just a matter of if it bothers some people more than others, it affects some people's GI linings more than others. So again, it's just about listening to yourself. If you're having such bad side effects that you really don't feel it's necessary, then cut back. And other people can take them and don't feel really any side effects at all, and lucky for them, then they can take them as needed.
Okay. And another common one, sort of allergy meds, sinus, antihistamine, nasal decongestant here.
Though, especially so I don't know of any terrible side effects from these other than, antihistamines in general cause drowsiness, but
don't drive. Don't even ride a bike in Manhattan.
But I never see biopsies or anything where it's like, oh, this is an antihistamine effect, so I don't have any wisdom on that.
Okay.
But my general attitude.
Stop use if nervousness, dizziness, or sleeplessness occurs. And if symptoms do not improve within 7 days. Can you imagine 7 days? Well, that would be unfortunate. Yeah. Okay, so a less concerning one there. All right, awesome. Any other little tips or tidbits that you really applied yourself when considering taking any medications?
They're there to help you. You know, like I'm such an I tend to be fairly extreme in my avoidance of medications, such that, you know, I had terrible, I got sick and I got terrible headaches, and it was only because I had to go back to work that I finally decided to take an ibuprofen even. And it helped immensely. So I just thought, why did I wait so long to take it? So you can go on the opposite extreme, right? And I think the key is just consider what you need in your life, you know, and tailor your use of medications to that. You don't have to go by what anybody else tells you. It's no good to be on one extreme where you're taking essentially cocktails of medications. It's also maybe not the best idea to tell yourself never to take something that might be helpful and have minimal side effects. So just be aware of your own body.
Thank you so much, Ben.
Of course.
Pleasure to chat with you, and I hope this was helpful to my friends out there. Thanks again for watching. It's Kimber Domke, mindful food and fitness coach, chatting today with Dr. Ben Cho on the myriad of things that we might add to our body besides food. All right, take care and take a sec to like and subscribe. Ciao.
Bye.